is the president up to now? For God's sakes. People said, oh my God, he's going to get rid of health insurance. What's going on? And I didn't take it as that. I took it as he's seeing correctly that it doesn't make sense to incentivize the insurance companies to raise prices year after year. And why are we giving it to them? And then there's the question of fraud, because it's very easy to sign people up for the Affordable Care Act exchange. And for instance, Senator Scott from Florida said in a Senate hearing, you need 3 things for an agent to sign us up for the Affordable Care Act. You need to know the person's name, you need their address, and their date of birth. That's it. So 40% of the fully subsidized people on the Affordable Care Act have no claims. That's very suspicious. And a lot of people probably are signed up for it and don't even know they're signed up. So those are the issues that the president wants to address. Now, I've been a long time advocate of people paying for much as their health care as possible with their own money, out of cash through an extended health savings account. I think the president's been listening to me. I think that's where he got that idea. He's listening to Real Doc Speaks. Thank you for listening, President. So I think there's a lot of great ideas there. When he says things like this, it's a general concept, and I love that. And obviously, you have to work out the details. But I think what we need to do is empower people to start shopping for their care. And there was a Senate subcommittee hearing on this about 10 days ago, and they had Dr. Keith Smith from the Surgery Center, Oklahoma, and he was talking about his prices. His prices that he charges are less than the prices for Medicaid, which pays very low, and they're half the price that hospitals get paid for Medicare. Now, why is this important? Because hospitals charge lots and lots of money, and that's the one part of healthcare no one's really paid attention to, is the hospital charges. And what happens if you talk to a hospital, and if I'm negotiating for a health plan, I said, a lot of people use Medicare as a reference. We don't want to pay you 300 or 400% of Medicare. That means 3 or 4 times what Medicare pays. But if the Surgery Center Oklahoma can make a profit at 50% of Medicare, why can't a hospital make a profit on 150% of Medicare?